Jaundice and hepatomegaly. Jaundice is a yellowish pigmentation of the skin, the conjunctival membranes over the sclera, and other mucous membranes caused by hyperbilirubinemia. Signs and symptoms. The main symptom of jaundice is a yellow discoloration of the white part of the eye and the skin. The conjunctiva of the eye are one of the first tissues to change color as bilirubin levels rise in jaundice. This is sometimes referred to sclera icterus. However, the sclera themselves are not icteric, but rather the conjunctival membranes that overlay them. The yellowing of white of the eye is thus more properly termed conjunctival icterus. Pathophysiology. Jaundice itself is not a disease, but rather a sign of one of many possible underlying pathological processes that occur at some points along the normal physiological pathway of the metabolism of bilirubin in blood. When red blood cells have completed their lifespan of approximately 120 days, or when they are damaged, their membranes become fragile and prone to rupture. Cellular contents include hemoglobin are subsequently released into the blood. The hemoglobin is phagocyted by macrophages and split into the M and globin portions. Two reactions then take place with the M molecule. The first oxidation reaction is catalyzed by the microsomal enzyme M oxygenase and results in biliverdin, iron and carbon monoxide. The next step is the reduction of biliverdin to a yellow-colored tetrapyl pigment called bilirubin by cytosolic enzyme biliverdin reductase. This bilirubin is uncoagulant-free or indirect bilirubin. Different diagnosis. Prehepatic hemolytic. The pathological is occurring prior to the liver. Hepatic hepatocellular. The pathology is located within the liver. Posthepatic cholestatic. The pathology is located after the conjugation of bilirubin in the liver. Hepatomegaly. Hepatomegaly is the condition of having an enlarged liver. It is a non-specific medical sign having many causes, which can broadly be broken down into defection, direct toxicity, hepatic tumors, or metabolic disorders. Often, hepatomegaly will present as an abdominal mass. Depending on the cause, it may sometimes present along with jaundice. Diagnosis. A suspicion of hepatomegaly indicates a thorough medical history and physical examination, wherein the latter typically includes an increased liver span. Blood tests should be done in part of the liver function series, which will give a good impression of the patient's blood. Causes. There are infective, neoplastic, cirrhotic, metabolic, and drugs and toxins.